Hi, this is John Kanellopoulos from our office here in Athens, Greece. This is Keratoconus rounds, and I want to share with you some very interesting information. This is a young gentleman who's 30 years old. These are his maps taken back in 2017. So this is about 4 years ago. You can see the overt keratoconus here in the left eye, minimal thickness, 5/12, and steepest cornea here at 50.8. And this is him today with marked improvement, despite the fact that his cornea looks thinner on Pentacam. Perhaps we're later in the day, and we are. His first image was 11 a.m. This image is at 5 p.m. So that's probably why we have a difference in cornea thickness, but the cone seems much flatter. We flattened about 1.8 diopters over the last 4 years, and this is mainly from cessation of eye rubbing. We're seeing him in conjunction with another gentleman who came to us. This is a physician, a young physician who's also 30 years old. And this is his cone in his right eye. And here, we've talked about this again in the past, despite the fact that he came in with Scheimplug tomographies, Pentacams. Our OCT images of the cornea confirmed the diagnosis of keratoconus with thinnest cornea here, and also the fact that this cone is active because there's marked epithelial remodeling here on the Optovue anterior segment OCT, which is even more prominent in the left eye. So left eye, the cone is a little bit more oblique, and we're seeing more marked epithelial remodeling to mask the steepening and thinning of the cornea here, thinner epithelium here, thicker around the cone. So we certainly believe that eye rubbing is a significant factor here, since the patient feels that his vision has deteriorated the last several years, and especially last year when he uses computers. And we will do, as a first measure, reinforce the fact to reduce rubbing of the eyes, because we may have a similar effect with the other gentleman that we saw here. That cessation of eye rubbing showed a marked improvement in the steepening of the cornea, and thus not only progression but marked improvement in the keratoconus indices. I hope you found this interesting. This is John Kanellopoulos from Athens, Greece, signing out. Thanks so much for your attention.